A reaction usually occurs within 10 to 30 minutes of exposure to the allergen, and if it's positive, a wheal or a hive forms at the site of the scratch. The interpretation of the test results should always be based on the comparison. Reactions graded from 2 to 4. However, as a general rule, a 2 reaction implies a wheal that is definitely larger than that of the control. A larger wheal is interpreted as a 3. In the presence of pseudopod, finger-like extensions around the surface of the wheal may be read as a 4. If a strong reaction occurs, the allergen extract should be carefully wiped off, preventing any further exposure. Patients should remain in the office for at least 30 minutes after the completion of the test to make sure no delayed reactions occur. The patch test uses allergens that is applied to the patch placed on the skin. It helps detect delayed allergic reactions associated with contact dermatitis. They are placed on the arms or back and must remain in place for about 48 hours, and they're usually removed at the next office visit. Skin irritation at the patch site indicates an allergy. The patient needs to avoid bathing in activities that can cause heavy sweating. These are some guidelines for allergen testing skin testing. Intradermal tests. They're more sensitive than the percutaneous test actually, and it's usually used to diagnose allergies to penicillin and insect venom, like these things. These extracts are injected into the intradermal layer of the skin in doses of 0.1 to 0.2 milliliters. It is also used for tuberculosis, the PCV test, and the valley fever coccidioidomycosis test. When the intradermal injection is used for the allergy testing, 10 to 15 allergies may be tested at one time on each arm. Reaction time is identical to the scratch test, however, antigen is more dilute. The radioallergen test, or the RAS measures levels of antibodies created when a sample of a patient's blood is mixed with allergen. It's easier to perform than skin tests because it requires a single venous puncture. And although the skin remains the preferred method of diagnosing hypersensitivity, RAS may be indicated when the patient cannot stop antihistamine medication, when a skin disorder makes accurate interpretation of skin test results difficult, when the skin test results are negative but the patient's signs and symptoms support further investigation. They are primarily used to identify food allergies. Treatment of allergies is used to encourage the patient to avoid known or suspected allergens. Unfortunately, this is not always possible, so the provider may prescribe an antihistamine medication, like levocetirizine, for relief of allergy symptoms. Over-the-counter antihistamines include Allegra, Zyrtec, and Claritin. Immunotherapy is a series of injections in which the minute doses of known allergens are administered subcutaneously over time to desensitize the patient's immune system and ultimately develop a resistance to immune response. It usually requires weekly or bi-monthly injections over several years. The patients here are cured, whereas others have only a minor reduction in the symptoms. Immunotherapy is controversial because it is expensive, invasive, and potentially dangerous. The treatment has unpredictable results, and it is recommended for severe allergies. The chemical peel, or the Simax qualification, are topical agents used in which the chemical peels to minimize or remove minor skin features. like acne scars, hyperpigmentation, and fine wrinkles. The agent's chemical peels include tretinoin cream, 0.05% to 0.1% concentration, and different acidic preparations to prevent the solution from entering the eye. The use of chemical exfoliating agents may cause the skin to feel inflamed and dry with crusting and stiffening. Patient may complain of stinging and burning at the beginning of the treatment regimen. We should avoid exposure for a length or sun exposure for a length of treatment and should use sunscreen with a minimum of SPF 15 because of photophobia, but is a light sensitivity because it is a typical side effect. Dermabrasion. This is a handheld device that mechanically evens the layers of a dermal tissue. It is effective in the treatment of the scars from acne vulgaris. Topical anesthetics like ethyl chloride are locally injected anesthetics besides dermabrasion. Dermatologists may use a variety of wire brushes, abrasive discs, and other devices to smooth scar tissue. Use face and eyeglass to prevent aerosol or splatter contamination from the site. Educate the wound care, signs of infection, and the presence of photophobia for 6 to 12 months after the procedure. Laser resurfacing or photothermolysis. Laser therapy can be used for fine lines and wrinkles, pigmented areas, shallow scars, and patchy removal. The patients are instructed to prepare the site 3 to 6 weeks before the procedure with retin A, alpha hydroxy solution with glycerin. They're performed under the local, regional, or general anesthesia. It is important that everyone has some certain type of PPE. After the procedure, cold packs are applied to help reduce swelling, and topical antibiotic ointment is used to prevent infection. Treated area appears inflamed and edematous and can take up to 2 weeks to heal. It can take as long as 6 months for the inflammation to fade. Botox injections. This is a strong neurotoxin, a substance toxic to the nerves. It's produced by Clostridium botulinum bacterium that causes food poisoning. There are 2 strains of this botulism bacterium are used. Botox can involve injections of the substance around the eyes, mouth, and forehead. This toxin interferes with nervous stimulation and can temporarily paralyze the muscles of the face that cause the wrinkles to form. It also smooths out the skin and makes it look younger. The efforts are short-term, so the treatments must be repeated every 3 to 4 months. And some patients complain of an inability to show facial expression because of muscle paralysis. That is all.